Hello, my name is Andrea Lopes-Sowers, and I'm a physical therapist and faculty member at the physical therapy program at Midwestern University in Glendale, Arizona. I'm honored to share the findings of our recent study, Physical Therapy Outcome Measures Used in Persons with Long COVID, a systematic review of interventional studies up to 1 year post-global health emergency. I'd like to acknowledge and thank my wonderful co-authors, Liana Johnson and Marisa Mortensen, both also from Midwestern University, Arizona, Laura Bianca and Luciana Angélica from the Federal University of Juiz de Fora in Brazil, Jaime Gonzalez from the University of Texas, Rio Grande Valley in Texas, and Cristino Oliveira, who currently holds affiliation with the Federal University of Espírito Santo in Brazil. The goal of our study was to identify which outcome measures are most commonly used in physical therapy interventional studies for people living with long COVID. These are individuals still experiencing symptoms 3 months or more after their initial COVID-19 infection. Our focus was on outpatient, home-based, and telerehabilitation settings. This was a registered systematic review conducted according to PRISMA guidelines. We assessed and analyzed interventional studies across multiple databases, covering publications up to 1 year after the World Health Organization declared COVID-19 no longer a global emergency in 2023. These studies involved adult participants undergoing physical therapy and used performance-based and/or questionnaire-based outcome measures. Our team mapped each measure to the core constructs recommended by international consensus and the American Physical Therapy Association. Across the 14 included studies, we identified 43 different outcome measures. That's a lot of variability, and in fact, over 75 of these measures were only used once. The most frequently used outcome measure was the Eurocall 5D, employed in 50% of the studies. This instrument assesses health-related quality of life and is well designed with core domain recommendations for long COVID research. Other commonly used measures included the Hospital Anxiety and Depression Scale for Mental Health, the Modified Medical Research Council for Dyspnea, and the 30-second sit-to-stand test for strength and endurance. We found that while many of these tools aligned with core outcome recommendations, there is still a lack of standardization in the field, a challenge for both research comparability and clinical decision-making. The Eurocall 5D is recommended for assessing quality of life in individuals with long COVID. Core domains like mental health, endurance, strength, and cognition are being evaluated, but not consistently. There's an urgent need for standardized use of clinically meaningful, validated measures aligned with the recommended core domains for long COVID to track recovery and guide rehabilitation. Our review highlights a critical opportunity. As physical therapists, we must work toward more consistent and evidence-based assessment practices in long COVID rehabilitation. On behalf of my co-authors, thank you for your time and interest in this important work.